Tennis elbow and golfer's elbow. Actually, both of them are not difficult. It is just that which one is lateral and which one is medial. And that is what they test in NEET PG, NICT and FMG. And let's discuss about it. So tennis elbow. Tennis elbow, also called as lateral epicondylitis. It is basically the inflammation of tendons of common extensor origin. Okay. So the lateral epicondyle, this gives origin to the extensor muscles of forearm. So this is the extensor aspect. This is the flexor aspect. Why flexor aspect? Because we flex like this. So this is flexion and the muscles over here are the flexor muscles. This is extension and therefore the muscles over here are the extensor muscles. And lateral epicondylitis, meaning here, is basically the inflammation of the tendons originating from this place. The most common affected tendon is the extensor carpi radialis brevis. Okay, so you just have to remember this. And the test we use to identify tennis elbow is Cozen's test or Mills test. Now, the way to remember this is Sachin Tendulkar. As you can see here, he also had this tennis elbow, and you can see here he is wearing a brace which is called as a tennis elbow brace. And the test which is used to identify this is called as a Cozen's test. In here, what we basically do is we stabilize the forearm, and the examiner basically pushes in the opposite direction of the patient. So patient has to do wrist extension, okay, wrist extension, and what we do is we try to do the opposite function. So this basically creates a tension and the patient will have pain in the lateral epicondyle. That is how you test Cozen's test. But in the exam, they will just ask you which test it is, or they will ask lateral epicondylitis is called what? Tennis elbow. So you just have to remember the word. Lateral is tennis and the opposite of it, medial, is of course golfers. So we see here medial epicondylitis, golfer's elbow. And the origin of the tendons is of course common flexor origin. Okay, common flexor origin. The tendons affected are flexor carpi radialis and pronator teres. And the clinical test to do is of course reverse Cozen test. This is the opposite of the one which I showed here. And in NEET PG NICT, they will limit you to just this. Lateral epicondylitis is which condition or which muscle is involved or which tendon is involved. And one of the ways to remember this is you can just remember that tennis bahar khela jata hai. Like bahar matlab ki lateral, and golf can be played inside. So what I mean by this is called as a golf stimulator if you have never seen. So like proper, like you can stimulate golf inside your house. So you can just remember it, golf inside meaning medial epicondyle. And yeah, that's it. So usually like how we treat this in OPD is usually we give a trial of analgesics and this belt which is called as a tennis elbow brace, and we can give physiotherapy. And if it doesn't get involved, then in very severe condition, then we open it up, we release the tendon a bit, and yeah. So this is what was tennis elbow and golfer's elbow, and I hope now you got a little bit of idea about it. Thank you.